1. Dog welfare, case studies from South Africa and Sierra Leone. 1.1. Providing veterinary care and education on dog welfare. Animals and specifically dogs are suffering in South Africa's various townships. The risk of rabies is high and stray dogs are reproducing uncontrollably. Additionally, there is a lack of available veterinary care. Private organizations work in cooperation with the local communities and some governmental bodies and veterinary services for South Africa, for example, in the capital Pretoria, and the Eastern Cape to improve the life of stray dogs. They work hard to ensure access to basic veterinary care, run multi-day neutering and vaccination campaigns, and increase public understanding of dog welfare through educational activities. According to recent estimates, 85% of all dogs in South Africa can be found in the townships surrounding the capital. Most people do not have the financial means for the veterinary care of their pets as well as for measures to prevent illness in the first place. Due to the dogs mainly roaming the streets freely, preventable illnesses, such as canine distemper or pan-leukopenia, can spread quickly. Likewise, many dogs as well as humans die every year due to rabies, since only 15% of dogs are vaccinated regularly against the viruses. 1.2. Basic veterinary care saves lives. Weltierschutzgesellschaft e.V. WTG is one of the biggest and most active organizations in South Africa in animal welfare. In cooperation with their partners, they offer free neutering of the dogs and cats of 6 townships surrounding Pretoria: Umzile Park, Plot 175, Atteridgeville, Mamelodi, Umfervat, and Refilwa, on 2 days per month, and at the same time use the opportunity to talk to the pet owners about correct animal care. Children often bring in their animals or come by simply out of interest. Additional support for this comes from the CVS SA from veterinary students from the University of Pretoria who assist our partner during their final year of study to gain practical experience, and to habituate them to the suffering of the strays in the townships. 1.3. Inspiring the animal welfare promoters of tomorrow. It's often the children of the families that care for the pets and play with them. It is thus essential to educate even the youngest township inhabitant on animal welfare and animal health. Therefore, WTG and/or their partners hold interactive animal welfare lessons in the regional kindergartens and schools for children ages 3 to 15. Every week they visit 10 groups or classes and talk about topics such as how to own and handle pets as well as the risk of rabies. Depending on their age, the children can participate afterward in drawing or awareness competitions. With every class or group visit, between 45 and 50 children are reached and then visited again each school year. These 30-minute animal welfare sessions are not only popular among the students but also the teachers. The schools and kindergarten now often directly contact our partner organizations to ask them to stop by. Not only this, but institutions from outside the townships have started to inquire about the service as well, thus making it possible to spread the thought of animal welfare among children of all backgrounds. 2 Dogs welfare in Sierra Leone. One of Sierra Leone's few veterinarians wage an uphill battle against rabies on a shoestring budget. Dogs are everywhere you look, dodging traffic, roaming the beaches, and scavenging in gutters for food. Many hops about on just 3 legs due to collisions with cars, and many more lie on the corners of roads, waiting for death to take them. These are the street dogs of Sierra Leone. For most of the West African country's population of 6 million people, life is a daily struggle. Most people live on less than $2 a day, according to the World Bank, and for much of the population, the fate of street dogs is not a major concern. But for one veterinarian, Dr. Gudish Jallo, helping these vulnerable creatures is a priority. During my work as a vet, I've seen many stray dogs which are sick, full of mange, skin diseases, abused by children. These animals have no future and were suffering, explained Jallo. My parents were advised to look for a rabies vaccine, but this was not available anywhere. 3 months later he showed signs and symptoms of rabies and died in agony. This occupied my mind for months, said Jalop. I then resolved that I should do all I can to contribute my knowledge and energy to fight against rabies. Rabies is a preventable disease. Through dog population control and vaccination, there will be fewer stray dogs suffering in the street, which also poses human health and environmental hazards. And I thought if this was done I would. The World Animal Protection has donated a veterinary mobile clinic, which allows Jalop to offer free vaccination, sterilization, management, and worm treatment to dogs across the country. So far, Dr. Brema Cardbo, Chief Medical Officer at Sierra Leone's Ministry of Health and Sanitation. Only about 4 veterinary clinics exist in entire Sierra Leone. Jalop is the only one who offers to spay, neuter, and vaccinate dogs against rabies for free. It's hard to say exactly how many dogs are in the county as there is no available data, but Jalop estimates the number of unowned dogs to be roughly 250,000. According to World Animal Protection, Freetown has one of the densest populations of dogs in Africa, partly due to an influx of refugees during the country's 1991 to 2002 civil war. Many brought their dogs with them. Many dogs were also abandoned, which led to further population increase, said Jalop. The consequence of dog overpopulation is that there is likely to be an increase in the cases of human rabies and possible rabies in livestock animals. Jalop is now facing a new challenge because funding from World Animal Protection has waned. He has received other donations, but they are few and far between. Now, the clinic may be forced to shut down. Working with animals in countries like Sierra Leone means there are a lot of sad stories. When there is a happy one, it is always very special. This happy ending was only because of Dr. Jalop and his incredibly talented and persistent team. I believe if I had not been with animals, I would have not met these people and I would have not got the help needed with insurance when I was going blind. How thankful I am to all of them and the animals, which provided the linkage from the bottom of my heart.